Dan, thank you. It's 9:17. We want to continue a discussion we've been having about attention deficit hyperactive disorder and the emerging understanding of what it is, what it isn't, and what else it could actually be. Some great things going on at Hartford Hospital right now. In fact, one of their researchers at the Institute of Living participated in a study looking at the causes of ADHD. And joining me to talk about it is that Dr. Michael Stevens. Thank you so much for joining us. Yes.
Thank you for inviting me.
Yeah, glad to have you here. And I guess there's so much to talk about. It's tough to pinpoint where to start, but it looks as if, as I was saying before, the way most people think about attention deficit hyperactive disorder is just being a problem with attention. We can get a lot more granular with that, and a lot of times it's not just that. There's other things going on.
Yeah, sometimes when you get a popular label like attention deficit hyperactivity disorder, people focus in on just one aspect. But physicians who diagnose this disorder know that it's a disorder where you have problems with attention, you have problems with impulsivity in particular, and doing things that are not expected, where you're rushing or blurting out answers or doing things too quickly without thinking, as well as the hyperactive component.
Okay, so what are you doing to help understand what's going on in some of these people's brains and start making more fine distinctions amongst the diagnostics?
Yeah, well, what I do is I run a functional brain imaging laboratory over at the Institute of Living. And what we've done for the last 5 or 6 years is study the impulsivity component of ADHD.
All right.
So we got about 250 adolescents, half of them with ADHD, half of them without ADHD. And we put them through a series of tests that were designed to tease apart different types of impulsivity.
Okay.
So the examples I like to give for this are the main way people have thought about impulsivity is, oh, I can't slam the brakes on my behavior.
Yeah.
And we know from research over the past 2 decades that there are certain brain systems that actually are engaged when you're trying to stop from doing something. But a completely different way to be impulsive is if you're really, really motivated to go after something. So I think of this as like the brakes and the gas. So it's an oversimplification, but it's a wonderful way to understand what we think of in terms of the brain.
So what are you seeing in the brain when you're looking for that on the fMRI?
So there's a system of brain regions, usually 2 or 3 circuits that involve lateral prefrontal cortex and the anterior cingulate, a couple of other key structures that seem to be more involved with stopping behavior.
Okay.
But then there's a system of the brain that is called the reward system. That is the ventral striatum, a structure called the nucleus accumbens. That seems to be engaged when we see something we like and we're motivated to approach. What our study did was they took kids that you couldn't tell apart in the clinic. They were all just as hyperactive, just as inattentive, just as impulsive. But we gave them very specialized tasks where they had to either slam the brakes on behavior or they were motivated to try to work for a reward. And when we did that, we were able to separate this group of kids into a group that had just problem with brakes, a group that had just problems with gas and brakes together, and a group that really didn't have many problems at all.
You see, that is so counterintuitive, because it would just seem like an impulse problem and attention problem could be one and the same. And you're starting to see now, and I say this because we're out of time, so I have to summarize somewhat, just how different it could be. Still, though, really quickly, as far as take-homes for treatments, we're not quite there yet with figuring out how this is going to change treatment.
Yeah, but this is the big implication of this. Yeah. When you find these different signatures in the brain neurally, they're a step closer to the cause. So if you recognize that you can have the same symptoms show up from completely different reasons, you have to ask yourself, does every patient need the same treatment? And that opens the door to really thinking about, well, maybe there isn't a one-size-fits-all medication. Maybe things like biofeedback, or maybe things like working memory training, or other experimental treatments might be perfectly tailored for one kid, but not another.
Wonderful. Doctor, thank you for summarizing so much in such a short amount of time. You know what? I'm telling you right now, I'm headed over to the Institute of Living at some point in the future to do a story and find out more about this fMRI research.
We've got lots of pretty pictures.
Yes, we like that. That's what TV's all about. Thank you again.